Assalamu alaikum. Celiac disease. Celiac disease is an autoimmune disorder. It happens when there is ingestion of gluten. So autoimmune activation happens uh, against the gliadin, results in inflammation of the intestine, and there is atrophy of the villi. In celiac disease is a very high yield topic for the exam. In here, the common antibodies we find, that is tissue transglutaminase, anti-gliadin antibody, anti-tissue transglutamate antibody, anti-endomysial antibody. If we get uh, from these three up to two, then we can easily say that this is a case of celiac disease. We can do biopsy to confirm, small intestinal biopsy, small bowel biopsy can confirm there is atrophy of the villi. So these three antibodies, sometimes antibody gets negative because in celiac disease some of them have IgA deficiency. So if there is IgA deficiency, if we do anti-gliadin, anti-endomysial, and anti-tissue transglutaminase antibodies, sometimes we may get the negative result. So sometimes we can do the IgG based antibody test so, to confirm the diagnosis. For actual confirmation, the most accurate test is a small bowel biopsy, where we can get the atrophy of the villi. Some clinical findings find in celiac disease, like in GI, there may be diarrhea, steatorrhea, there may be weight loss, abdominal pain, flatulence. There, in late manifestation, there may be ulcerative jejunitis, enteropathy related T cell lymphoma. The most common manifestation uh, found on celiac disease, that is dermatitis herpetiformis, is a skin manifestation most common. Sometimes may get the tongue problem, atrophic glossitis. In house, there is an episode where we found a patient where there is he present with the atrophic glossitis. Sometimes we may get the endocrine manifestation like vitamin D deficiency, secondary hyperparathyroidism. In bone disorder, there is osteomalacia, osteoporosis, and rickets. In hematological, there is IDA. In neuropsychiatric, there is peripheral neuropathy, sometimes depression and anxiety. These are the common clinical manifestation we may get a patient with celiac disease. And the treatment is the triggering thing, like uh, gluten. You have to avoid the diet where there is presence of gluten, and that's all. Hope you enjoy.